Patsy, thank you for joining us today to explain some of what you have had here in medical care in Santiago. And I think it's particularly interesting that you've actually been an RN for 35 years in the United States. So you have an interesting perspective to share with us. Thank you for joining us.
Oh, thank you, Dr. Vliet. I'm glad that I'm here so I can share. Yes, I've been an RN for 35 years, and I have worked pretty much every area of the medical field and psychiatric field. So I feel like that coming here and having surgery here in Santiago, I can look at it from a different perspective than the average layperson.
So you had expectations that you wanted to have met in making your decision.
Most definitely. I knew exactly the type of care that I needed, and I have felt like that talking with friends that have lived here, that have had like surgeries. I had a friend that had a double hip replacement here, and mostly it was because of my friend and the good experience that she had here in Santiago that I chose to stay here and have my torn meniscus repaired.
So instead of flying back home to Texas?
That's correct. That's correct. It honestly never occurred to me to do that. I just had been a visitor in several Santiago hospitals, and I liked the cleanliness, the friendliness, the professionalism that I saw just as being a visitor, that I thought to be a patient would be just optimal. It had to be.
Great. Well, when you had your knee surgery, you were telling me about how pleased you were with the physiotherapy, or what we call physical therapy, afterwards. Tell us a little more about that.
Well, one of the best things about that is that the doctor's clinic was just right next door to, or actually it was under the same roof as the physical therapy facilities. And what was so nice about that is that during physical therapy, he could come over and just see what I was doing and see the level of conditioning I was getting, and he conferred with the physical therapist, and he, said, "Yep, you're on the right track," or "Why don't you try a little bit more of this?" And that to me was, I felt like it was a more holistic approach to my care, because everyone was on the same page, because everyone knew exactly what I was doing and watched my progress. So that was good. That was a very good, it was a comfortable feeling for me to know that they kind of looked at me more personal that way.
That's true, and I have heard that from others and experienced it myself as well. You also mentioned something that's different, I think, in that you mentioned the length of time that you've been able to have physical therapy, having it here.
Correct. First off, before I begin that, I need to let you know that when the doctor said I needed surgery, he said, pick your day. You can have it anytime. There was no wait time. So it was more pick your day and we'll make it happen that day, which was nice to be able to just schedule it right there before I left the doctor's office. So that right there was a good thing for me. I didn't have to wait. So the wait time for that was great. Also, before surgery, he had me do 10 sessions of physical therapy just to strengthen my muscles in my leg so that surgery would go better and post-op care would be better, having a stronger leg. So after my surgery, he prescribed 10 more sessions, and I'm about to the end of that, and he's prescribing 10 more. So that would be a total, if he chooses to stop there, that would be a total of 30 physical therapy sessions, which I seriously doubt that insurance would have approved that in the U.S.
I think you're right, from what I've been seeing as well. Did you have any trouble, or have you had any trouble getting any medications that you've needed?
Not at all. In fact, no even wait for refills. He no problem at all. actually. I went, I haven't needed anything refilled, but it was basically, I got out of, it was a day surgery, and I left the hospital at 10:30, and by 11 o'clock I'd gone by the pharmacy that was open here in Santiago, and they all seemed to be, but I chose the one that was closest to my house, and by 11 o'clock I was at home with the medications that I needed and ready to go to bed in my own bed. So that was very good.
Are there any other things that stand out as positives in your experience here, or things that you particularly liked?
I feel like that I am the most important patient that my doctor has, and I know that's not true, but that's the way he makes me feel. I felt like that he was on top of everything, and when it came time for my sutures to come out, usually that would be a job for an RN or an LPN, but the doctor himself took my sutures out and watched me walk, spent a lot of time with me, and that was not a paid appointment. That was just, come in and I want to see you in between patients. And I waited 5 minutes and he took me in. So I think that personalization of my care, I think that stands out more than anything, because you like to feel like that it's just as important to the doctors and the physical therapists that are taking care of you as it is to you. I just feel like that they wanted it for as much for me to have a good outcome as I did myself.
That's wonderful. That's very heartwarming, actually. Thank you so much for sharing your experience. I really appreciate it.
Okay, thank you for having me.